Introduction to adhesive dentistry. There are many bonding systems available, some simpler to use than others, some more effective than others. What is most important is that your bond works and carries on working in clinical situations and gives your patients good long-term service and gives you the good reputation that is important for long-term success. Achieving dental excellence is simply a matter of following some simple recipes using the right ingredients. Simply using tried and tested materials and techniques guarantees that you have the golden touch and confidence in the durability of your restorations. Modern bonding systems can be classified into 3-step, etch, prime and bond, 2-step etch and rinse, etch and then the prime and bond in one bottle, or self-etch, which can be either 1-step with everything in one bottle, or 2-step, which involves a separate primer and bond, where the etching and priming is contained within one bottle and the adhesive in the second bottle. Now we're going to look at 4 clinical studies which evaluated restorations of class 5 non-carious cervical lesions. Now why class 5 lesions? Well, these are the simplest forms of adhesive restoration that do not use any retentive features. We can then adopt what is most effective from these studies to achieve the best possible long-term success rates in all other adhesive restorations. Now, study 1, a 13-year clinical evaluation of 2 3-step etch and rinse adhesives on non-carious class 5 lesions by Puins et al. And this was published in Clinical Oral Investigations in 2010. Now in this study they compared the clinical effectiveness of 2 3-step bonding systems. They looked at 142 non-carious cervical lesions which were restored with composite following 2 out of 3 adhesive procedures. In procedure 1 they used Optibond FL and Prodigy. Procedure 2 they used Permaquick and Amelogen microfill, and procedure 3 they used Permaquick and Amelogen hybrid. All restorations were placed using rubber dam. A 1 to 2 mm enamel bevel was prepared to increase the surface area for bonding and to enhance aesthetics. And the adhesive systems were applied following the manufacturer's instructions, and the composite was then applied in 2 mm layers. Each layer was cured for 40 seconds with a 1000 milliwatt per cm squared light, giving 40,000 millijoules of curing energy. And table 1 shows the survival of 3-step bonds in class 5 lesions. Using procedure 1, which was Optibond FL and Prodigy, they achieved a 13-year survival of 88%, giving an estimated 10-year survival of 91%. And then using the Permaquick and microfill composite, they achieved a 13-year survival of 78%, giving an estimated 10-year survival of 83%. And then using the Permaquick and the hybrid composite, they achieved a 13-year survival of 74% and an estimated 10-year survival of 80%. Now the next study looks at 2 etch and rinse adhesives. Now study 2, an 8-year evaluation of filled and unfilled 1-bottle dental adhesives by Ritter et al. And this was published in the Journal of the American Dental Association. And this study, they evaluated 99 cervical class 5 non-carious lesions for 8 years using either Optibond Solo and Prodigy, or using Prime and Bond 2.1 and TPH Spectrum. And this study, they did not use rubber dam, and they did not bevel the enamel margins. Now they applied the adhesives according to the manufacturer's instructions, then a second coat of adhesive was applied. And then the composite was placed and light cured for 40 seconds per 2mm increment with a 500 milliwatt per cm squared light, giving about 20,000 millijoules of curing energy. Now, table 2 shows the survival of the two-step etch and rinse bonds in class 5 lesions. Using Optibond Solo and Prodigy, they achieved an 8-year survival of 69%, giving an estimated 10-year survival of 61%. And using the Prime and Bond 2.1 and TPH, they achieved an 8-year survival of 59%, giving an estimated 10-year survival of 49%. So even though the authors used 2 coats of bond and in fact did not save any time compared to the 3-step systems, you could be reducing your 10-year success rates from as high as 91% to 61%, or even less, 49%, if you're using the Prime and Bond. Now just imagine those beautiful veneers that you place debonding or fracturing prematurely just as a result of 1 or 2 small differences. Study 3 looks at a 1-bottle self-etching adhesive using different protocols. Study 3. Application of a dental adhesive using the self-etch and etch and rinse approaches, an 18-month evaluation by Logorecki and Rees. And this was published in the Journal of the American Dental Association in 2008. Now in this study, 116 restorations were placed in class 5 cervical non-carious lesions using a 1-bottle self-etching adhesive. Now they did use rubber dam, and they did not use retention features or bevel enamel. And the operators applied composite in 1 to 3 increments and light cured each increment for 30 seconds using a 600 milliwatt per cm squared light, giving 18,000 millijoules of curing energy. Now they experimented with 4 different procedures using the same 1-bottle self-etching adhesive. Procedure 1, they used no etch, 2 coats of adhesive, then applied the composite. Procedure 2, they used no etch, 4 coats of adhesive were applied, and then applied the composite. And procedure 3, they etched, rinsed, and applied 2 coats of adhesive, and then the composite. And procedure 4, they etched, rinsed, and applied 4 coats of adhesive and then the composite. Now table 3 shows that 18-month and estimated 10-year survival of this 1-bottle self-etching adhesive in class 5 lesions. Using procedure 1, which was no etch and 2 coats of the adhesive, they achieved an 18-month survival of 56%, giving an estimated 10-year survival of 0. Using procedure 2, which was no etch and 4 coats of the self-etching adhesive, they achieved an 18-month survival of 78%, again giving an estimated 10-year survival of 0. Then using etch and rinsing and applying 2 coats of the adhesive prior to applying the composite, they achieved an 18-month survival of 70%, again an estimated 10-year survival of 0%. And then using procedure 4, which was to etch, rinse and apply 4 coats the self-etching adhesive, prior to applying the composite, they achieved a much improved 18-month survival of 89%. However, this still only gives an estimated 10-year survival of 26%. Now, the best results with this self-etching adhesive were achieved using etch and rinsing and then applying 4 coats of bond, which has more steps in it than the 3-step. By using the 1 bottle self-etching adhesive, your success rates could drop from as high as 91% 10-year survival to between 0 to 26% 10-year survival. Just imagine how that could affect your veneers and other expensive restorations. And the next one, in study 4, we're going to look at prospective 8-year evaluation of a mild 2-step self-etching adhesive by Van Deeken. And this was published in Dental Materials in 2010. Now, in this study, 55 Class 5 restorations were placed in non-carious cervical lesions without intentional involvement of the enamel of the lesions using a 2-step self-etching bonding system, Clearfill SE from Curaray. And they restored with a nanofilled hybrid resin composite 0.4 from Kerr. And this study, they didn't use rubber dam, they did use cotton rolls and suction for moisture control. Now, the 2-step Clearfill SE bond was applied according to the manufacturer's instructions, and the composite 0.4 was applied, and each layer was cured for 20 to 40 seconds using a light with 750 milliwatt per cm squared power, giving between 15,000 to 30,000 millijoules of curing energy. Table 4 shows the survival of fillings bonded using Clearfill SE in Class 5 lesions. Using Clearfill SE and 0.4, they achieved an 8-year survival of about 75%, giving an estimated 10-year survival of just over 68%. So we can see that not all self-etching adhesives are the same. You can see from the bar chart here that the 3-step systems give the best results, giving an estimated 10-year survival between 80 to about 91% 10-year survival. Using the 2-step etch and rinse systems, we can see we got achieved between 49 to 61% estimated 10-year survivals, and using the self-etch, 1 bottle self-etch, we achieved between 0 to 26% estimated 10-year survival, and using the Clearfill SE, the 2-step self-etching system, we achieved up to 68% 10-year survival. So, what can we conclude from these? Quite clearly, 3-step bonding is more durable than 2-step and self-etch. We can also see that enamel bonding is more durable than dentine bonding. Study 1 is the only one where they used 1 to 2 millimeters of enamel to bond to, and this definitely gave better results. And more light energy will definitely give us better results, because if we have properly cured composites and properly cured bonds, they're going to work as they're supposed to. Now, more light energy can come in the form of either curing for longer or using more powerful lights. We can also see that using rubber dam does not necessarily improve survival. Study 3 did use rubber dam, yet they only achieved up to 26% 10-year survival. So rubber dam does not necessarily improve survival. But what is most important is using tried and tested materials and techniques works. Here we have an upper right first premolar with a non-carious cervical lesion which is to be restored using composite. We are bonding to 2 to 3 millimeters of enamel without a bevel to conserve tooth tissue. They try to increase the surface area as much as possible. the shade here is being planned, and we've got the shade guide arranged in order of value, and even going from the lightest to darkest. As we can see here, we just slide it along, and as we can see, A35 is looking pretty much like the right shade. However, we're going to go and check all the other shades just to make sure. Like I said, the shade guide is all arranged in order of value, going from B1, A1, B2, D2, A2, C1, C2, D4, A3, D3, B3, A3.5, which is what we're using, B4, C3, A4 and C4. Now the good thing with arranging it this way is that with it being arranged from lightest to darkest, as you slide along, you very quickly and quite easily can find what is most appropriate. However, I seem to be dithering around a little bit with this one. But we did come to the A3.5 first of all, and I think that's probably the most appropriate shade there. Again, it's not an exact match, but the good thing with using this technique is that it allows the shade of the natural tooth underneath to shine through and just blends in and gives a nice harmonious finish, because we're spreading the composite across to 2 to 3 millimeters of the enamel, and where this is quite thin, it will allow a natural gentle transition from tooth to composite, and it just gives a nice harmonious result. And here we can see finally we've decided on using the A3.5. The enamel then is etched first of all here. You can see to about 1 to 2 millimeters beyond the planned margin, and we plan to etch to about 3 millimeters of enamel, which means we want to actually etch about 5 millimeters or possibly more of enamel. And this allows for a gradual change from filling to tooth, and it results in a nice harmonious aesthetic result. It gives a blended aesthetic result, as I've written here, in terms of the shade. And we don't really want to etch dentine for any more than 15 seconds, so the etch is rinsed off and the tooth is being dried. Obviously you can see here we're not using rubber dam. Rubber dam in class 5 lesions can be a bit of a more of a hindrance than a help. Obviously we're working down by the gingival margin. Anywhere where you're working by gingival margin, rubber dam would really get in the way. So the tooth is rinsed and dried. We're then going to apply our primer. In this case we're using the OptiBond-FL Prime. This needs to be applied for about 15 seconds to both enamel and dentine. And the primer does a couple of things. Obviously it increases bond strength, but apart from increasing bond strength, it massively reduces any sensitivity. For example, in this case we've not used any local anaesthetic, so the tooth will be quite sensitive after we've washed the etch off. As soon as we apply the primer, it reduces any sensitivity. Now, after applying the primer, the tooth is dried. Now I like to apply about 2 to 3 coats of OptiBond-FL Prime. This is not absolutely necessary, it's my little OCD. However, it helps me sleep better at night. I know that all parts of the tooth are fully covered, and it just gives a better long-term result, I think. So you must remember, this is not absolutely essential, it's just my little OCD. However, I don't think it particularly does any harm applying more coats of prime really. And then the OptiBond-FL adhesive is applied and air thinned. Again, we're applying this with a light brushing motion for about 15 seconds. And then this is air thinned. And we want to light cure this for about 20 seconds using a 1000 milliwatt per cm squared light. Now if you were to be using a more powerful light, you could get away with curing for a shorter period. For example, if you're using a 2000 milliwatt per cm squared light, you could cure for as little as 10 seconds. However, if you're using a less powerful light, for example 500 milliwatt per cm squared light, you'd want to cure for about 40 seconds. Either way, giving the same amount of light energy. Then in this case, the composite I'm using is a Filtech Z250. I've been using this for 12 years and it works very well in my hand. The composite is then shaped with a carver or flat plastic and then smoothed over using an inside out glove. Now obviously there's a little dimples on the glove. Using an inside out glove, it will be smooth, so you create a nice smooth polished finish which doesn't require an awful lot of polishing afterwards really. And then the composite is light cured for 60 seconds with a 1000 milliwatt per cm squared light. In study 1, which is where they achieve their best long-term success rate of 91% 10-year survival, they cured for 40 seconds with a 1000 milliwatt per cm squared light. I think curing for longer periods can only result in more thoroughly cured composite and stronger composite, and therefore more durable results. Again, remembering if you have less powerful lights, you will need to cure for longer. If you have more powerful lights, you can slightly reduce these curing times. Now obviously in class 5 lesions, we're not relying an awful lot on strength because they're not really in occlusion or anything. However, if you imagine you've got an upper molar being used, we're going to need a much stronger result, and I would recommend curing for even longer periods for posterior teeth in occlusion. Now you can see here it's pretty much finished. We're just going to clean up the gingival margins a little bit with a fine narrow diamond. In this instance we're not using any water spray at all, just so that we can see a little bit better and save drowning our patient for the moment. I have to excuse my head getting in the way. There we go, so we can see a nice polished gingival margin there as well. We could quite easily leave it like this now. However, it's well worth then going over it again with an ultra-fine composite finishing burr. However, when using the ultra-fine, we do need to use water spray, because if we use these without water spray, you'll burn your burrs out. So we're just going to go over and check over any bits that need a little bit more polishing up there. And as you can see, the shade and the aesthetics of it are looking very good there, using very simple techniques. So here we have the finished result. You can see that we have a good looking restoration. So What can we conclude from these? Quite clearly, 3-step bonding is more durable than 2-step and self-etch. We can also see that enamel bonding is more durable than dentine bonding. Study 1 is the only one where they used 1 to 2 millimeters of enamel to bond to, and this definitely gave better results. A more light energy will definitely give us better results, because if we have properly cured composites and properly cured bonds, they're going to work as they're supposed to. Now, more light energy can come in the form of either curing for longer or using more powerful lights. We can also see that using rubber dam does not necessarily improve survival. Study 3 did use rubber dam, yet they only achieved up to 26% 10-year survival. So rubber dam does not necessarily improve survival. But what is most important is using tried and tested materials and techniques works.